Alright, here we are, Lab 2, Heart and Mediastinum. This is sort of where we're picking up from last time. We are looking at the mediastinum in situ, where you can see the heart, some of the structures that are posterior to the heart, and then the structures that are superior up here. That's going to be the mediastinum work for today. So you'll remember from last time our phrenic nerve, which ran along this surface. And here, let me just turn the label on there. Go back to that. So the phrenic nerve that was anterior to the root of the lung on both sides. So this was root of the lung structures here, and phrenic nerve was in front on both sides. Here's the other phrenic. And then we're going to start looking at the heart. Probably the first thing to identify is the right and left ventricle. These should be pretty obvious as the right and left borders of the heart. The great vessels that leave the heart at its base, the superior vena cava, the aorta, and the pulmonary trunk, these form sort of a row from right to left. So try to identify those right away. From a procedural standpoint, that's going to be one of the first things you do, is you actually just cut these three vessels off nice and close to the heart, so that you leave a lot of these vessels in the thorax to look at in the mediastinum. Okay. Then after you cut this vessel off, the inferior vena cava here, you're basically just going to take the heart out and then start to work on the heart in isolation. And the first thing I think that makes sense to work on is the coronary vessels. It's on the outermost part. We'll work through both the right and left systems. So first, the right coronary artery you can find branching off of the ascending aorta. That's probably the easiest place to find it, right at its origin. And then you can push this little auricle of the right atrium back and follow the coronary artery. Expect to find lots of fat surrounding that vessel. We'll follow the right coronary down, and then we'll try and find this branch of it, the marginal branch of the right coronary that runs along the edge of the heart, and then we'll follow it around to the backside, and we'll find the distalmost branch of the right coronary, the posterior interventricular branch. Then we'll turn to the left coronary, and that one also comes off of the aorta. You can see its origin there, and passes inferior to the pulmonary trunk and then divides in two. And then those two branches are the anterior interventricular and the circumflex branch. And you can trace them out to their destinations as well. And then as you're going with these arteries, you should be finding accompanying veins with them, like great cardiac or middle cardiac. Alright, then after you get the outer parts of the heart done, you're going to cut open the atria and ventricles to expose the internal structures, and the dissector does a nice job of providing you some figures that'll show you just where to cut and how to open these things up. It's not quite like this. We're not cutting the whole heart in half, so consult those figures when you do that step. We'll also look into the atria. And again, this isn't going to be the best view ever in this model. It doesn't have all of the internal structures, but we'll try to identify some of these muscular ridges in the atria as well as in the ventricles. There's names for all of these different surfaces and papillary muscles, these different structures that are attached to those. So that'll be part of your work on the heart. So while one of your or two of your team members is working on the heart, the other team members should be working on the mediastinum. So we'll sort of divide and conquer this work. So the members who are working on the mediastinum, if everything went well with your lung removal and your heart removal, you should have phrenic nerves that are now suspended in air, running down to their attachment on the diaphragm. If not, that's okay, because we can always attach it later, but that is best case scenario. Then the first thing I think that makes sense to work on is the arch of the aorta. It's the biggest thing in the area. Your brachiocephalic vein and your superior vena cava and these branches, they may not be this far away from the aorta, so you may need to push those out of the way. But if you do, and you get this sort of space to work with, you should be able to identify these three large arteries coming off of the arch of the aorta. And probably, depending on how the heart removal went, you might have a little bit or a lot of the pulmonary trunk and its branches. Then take a look at this piece of tissue that connects the aorta and the pulmonary trunk. This is called the ligamentum arteriosum. This is the fetal remnant of the ductus arteriosus. And then if you look just behind there, there's a pretty large nerve, should be on the lateral surface of the arch of the aorta. That's the left vagus nerve. And you shouldn't have any trouble finding that if you just strip away the membrane that's covering that aorta. And then if you look at these two structures, ligamentum arteriosum and vagus nerve, there's a branch of the vagus that you ought to be able to see branching underneath the arch of the aorta, right behind the ligamentum arteriosum, and that's your left recurrent laryngeal nerve. We won't find the right. It branches off a little bit higher, so it's harder to find in the chest, but the left we'll definitely try and find today. Then the rest of the vagus continues on and forms what's called the esophageal nerve plexus, which wraps around the esophagus and then continues on into the abdomen to supply abdominal organs. The rest of the structures of the mediastinum are more or less all associated with the central pillar of vertebrae. So the far leftmost is going to be the aorta. The most anterior will be the esophagus. The rightmost will be the azygous vein. And kind of situated in between all of them is going to be the thoracic duct. That's our one large lymphatic vessel that we're going to find in this course. You can expect to find it right in that space between them. There will be all kinds of fat filling this space between them, but you can expect to see it in there. Then probably it'll be easiest to do this neurovasculature dissection on the right side because there's more space, but you may also be able to do it on the left. We're going to expose one neurovascular bundle in the intercostal space to find the intercostal vein, artery, and nerve. Typically in that arrangement, vein on top, then artery, then nerve. And we're also going to try and identify the sympathetic chain, which should be running vertically across the heads of the ribs and in association with the bodies of the vertebrae. And then we'll identify these branches, which connect the ganglia to the intercostal nerves. These are the gray and white rami, which are taking fibers to and from the chain ganglia. Then the last objective in this part of the dissection will be to look at the chain ganglia and try and find branches that are emerging and branching medially and anteriorly from the chain. These are going down to innervate abdominal organs with sympathetic innervations, the splanchnic nerves. In this region, you'll most likely only be able to find greater splanchnic in the T5 through T9 levels. So that is the only one we're going to try and find. So that is the mediastinum and heart in a nutshell.